Hello, 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 everyone. Happy Friday. Welcome, welcome, welcome. Welcome to another session of Q&A with Dr. Mercy. I'm going to wait a while to see if everyone is here before I begin. Again, welcome, welcome, welcome. If you are here, if you could write in the comments, I'm here, and also write where you are viewing this live broadcast from. Hello, 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 hello. Let me look at the comment section to make sure we are live. Because if you are here, please let me know. For some reason, I'm not seeing comments or anyone on just yet. Okay, I'm starting to see one person. Hello, hello. If you're seeing me, please let me know. If you see North Carolina, hi Tamika. Okay, I'm seeing them now. Hi Tamika, how are you? From Louisiana, okay. Dr. Monica Jackson, hello, how are you? I have some lotion on. Katrina Parker, Alabama, okay, all right. Tracy Spencer, you're from Tampa, Florida. Awesome. Hello, good evening. You're Katrina Cohens. You're from Georgia. Okay, nice. All right, from Detroit. I see you. Thank you. North Carolina. Hi. Good evening. Good evening. Okay, we see you. Thank you. From LA, California. Okay, and New York. Thank you, guys. Thank you. I wanted to know if you could hear me. I wasn't getting any comments. It was a little bit delayed, but I'm glad you can. Hello again. Welcome, welcome, welcome to another session of Q&A with Dr. Mercy. I'm Dr. Mercy, Chicago, Dallas, close by Chicago. All right. I'm Dr. Mercy, and welcome to another session of Q&A with Dr. Mercy. Charlene, hello. Hi, everyone. Okay, well, let's get started. I haven't been around in these streets for a while, so I just want to say, first of all, Happy New Year's. Thank you. Thank you so much. Just want to say Happy New Year's, first of all. And I know some of the previous broadcast has been by Dr. David Ajibade. He's been talking about dementia and in the Black community. So if you haven't heard his session, he has really good insight and information when it comes to that. Feel free to go on the BWE platform, social media platform, whether it's LinkedIn, whether it's a Facebook, whether it's YouTube, and look at those previous footage because he does give a lot of gems in those broadcasts. What he has realized in his research of dementia is that a lot of the caregivers don't really understand the nature of dementia. Dementia is a very debilitating, progressively debilitating disease. And the more you know the signs, the better that the person, whether it's your mom or your dad or relative, but the better that they can get tested for dementia, and the better it is, the earlier that you detect the symptoms, the earlier they can get medications for it. And even though it does not cure it, it does sometimes slow the progression. And then for some of these symptoms that they exhibit as they progress along with dementia, such as agitation or irritation, having an early detection is key because you can be able to treat them with certain medications to kind of calm them down. A lot of people, when I see them in the hospital and they have patients with dementia, thank you, Melissa. Yes, dementia is in an increased rate, actually. A lot of people that I see in the hospital, when I see them as patients, they're like in the 70s, 80s, 90s. And after my many years of experience working with patients who have dementia, I kind of can get a sense just by talking to them within 10 minutes that, oh, this one has minimally underlying cognitive impairment, if not dementia. So as I talk to the patient's family members, because I can't get a history, I can't get an understanding of what brought the patient in, so I have to talk to the family members, I always ask them, does your mom, does your dad, does your uncle, does your aunt have dementia? And they're like, oh, no, they don't. I was like, but do they have trouble? Do they have forgetfulness? Yeah. Are they able to, conduct the daily living of activity? Can they be able to dress themselves okay? Can they cook for themselves? Could they clean for themselves? No, they need assistance. Do they even remember you sometimes? Sometimes they don't remember me. Oh, but it's that's how we are as as we're gonna get older. We just imagine that you're gonna be forgetful. No, that's not how everyone is. I treated people who are 97-year-old, who are quick, who are witty, who are talking with conversations, and they remember things, and they're able to understand what is presented to them. So that's not how everybody is. So if you start noticing in your family members that people are forgetful, people, they may, they cook something and they forget about it. Okay, once in a while is okay, but if it's consistent, that's an issue. If as you're talking to them, you're asking them questions, they're not able to respond back, or they're forgetful of your name, or they're forgetful of how to do simple things, then start getting them tested. The sooner, the better. Because with dementia patients, what I've observed with caregivers is as they get to this level where their dementia starts being more obvious, but not to the family members start, as the dementia patient starts to do things like irritation. They a lot of dementia patients, they can get very irritated very easily. They'll just get angry, and so the family member thinks they're angry at them, not knowing, no, it's the disease that's causing them to be like that. And so a lot of the things that the family members had had to endure with this patient, had they known it was due to their dementia, things would have been a lot easier for them. So, what are some things? Tell me things to ask, please. Well, things to ask about what? I'm not quite sure what you're talking about. But anytime you see in an older patient forgetfulness, and so this is how and this is not the topic of my conversation, but it being an important conversation to have, we'll just talk about it. When I assess someone in the hospital, first thing I want to know is, how oriented are you? What does that mean? I will ask you, okay, where are we at? That's the first thing I ask them. If they don't know where they are, that's a high tail sign that they're cognitive, they have some sort of cognitive impairment, and likelihood they may have some underlying dementia. If they don't know the time and the date, yes, that can be typical. As we get older, we lose track of time and date, but if it's consistent, is something to look further in. And especially if they don't know their name, okay, then you're in trouble. A lot of people who have previous medical histories of strokes, over time, dementia tends to be something that they can develop. So keep that in mind, especially any of your family members who have had or strokes in the past. They start being forgetful. That's something to consider. If they start wandering off into outside and they don't know how to get back to the house, that's a problem. Like I said, with the cooking, that's a problem. So just start noticing how their mental change is. If they can't tell you what you and them have been talking about the last 10 minutes, but they can tell you what happened in 1950, that's also that's also a sign that there may be some dementia underlying. So if you start considering and wanting to know, okay, I think my mom, my dad, my aunt, my sibling, or even my uncle may have dementia, what do I do? Well, obviously you go to your primary care doctor, you speak with them, and they can refer you to a neurologist who can now do some neurophysical testing to see exactly if this person has dementia or not. They're likely going to do a scan of their head. If they notice that the person, when they do the scan, has history that has some underlying old strokes, that's an increased risk factor, like I said. Then they'll do some of the testing that I even just told you right now, as far as, oh, how oriented are they with their surroundings? How quick do they remember things? Like they'll give them a pen. They'll say, "Here, what is this?" And they'll say, "Pen." Okay, here, what is this? This is a cup. Okay, in 10 minutes, I'm gonna ask you, what did I just show you? So they'll go off, talk to them about something else, and then after 10 minutes is up, and say, what were the 2 items that I showed you? If they can't remember those 2 items, there's a likelihood that there's some underlying dementia. So these are just some of the keys that you want to keep in mind when you're dealing with older patients. And when they have dementia, I just always want to stress with the family that some of their actions is not necessarily because of who they are. It could be because of the dementia. So I'm done talking about that, but Dr. David Ajibade will be back, and he'll likely continue on with the topics of dementia. So if you have any questions, again, he did do some previous lives on it. So you can always go back to the Black Women Empowerment, BWE, Facebook, LinkedIn, or YouTube and look at those. I think me and him did a session. I know we did a joint session when it came to dementia, and we talked more in depth with it. So it's definitely something that we want to start bringing awareness to, because the baby boomers are getting older, and we're seeing them in the hospital, and we're seeing more dementia than probably maybe in previous years. So, but that's not why I hopped on this live today. That was not the topic of discussion. The topic of discussion was really about New Year, New You. You know, every single time January 1st comes along, we always have these ideas of, oh, New Year's resolution. And a lot of times than not, part of the New Year's resolution is, you're welcome, Chanel. You're welcome, Chanel. Thank you. Part of the New Year's resolution is, okay, something about my health. I want to do something good to myself when it comes to my health. I want to have an optimal health. So I wanted to take this opportunity to talk about what are some things that you want to do. It doesn't necessarily have to be in January, but throughout the year, to kind of make sure that your health is optimal. Essentially, for me, there's 2 things that I always love to say. Knowledge is power. So the more you know, the more you can be able to do things about whatever it is you need to do. And then the second thing that I always talk about is prevention is key. So this is along the lines of prevention being key. When I wrote get screened, what I meant was get screened is every year you should have an annual wellness checkup with your primary care doctor. And they will go through a whole bunch of testing. They will, and sometimes when they go through these testing, you may not know what they're doing. So it's a good idea to have a little bit of medical knowledge of what's going on, so you can know, hey, check off the box. Am I getting screened for this? Am I getting screened for this? Am I getting screened for this? I mean, countless of people I see in the hospital, before they get to the stage 3 or stage 4 of kidney disease, had they gone to their primary care doctor earlier on, they wouldn't have gone and now been on dialysis because they're in severe kidney disease, or have this particular cancer. Had they gotten screened earlier, they probably would not be in the predicament that they're in. So I always am a proponent of, let's get to know exactly what's going on in our body so we can nip it in the butt as early and as soon as possible. So with that, I'm going to share my screen and talk about what are some adult medical and health screenings that we should do on an annual or a periodic basis to make sure our health is in check. So I am going to start just a second. So let's go over here. Okay, so as people age, they're prone to developing various health conditions. So like I said, prevention is better than cure, and early detection leads to a higher chance of cure. So here are some of and I said senior citizens, but really I shouldn't have said senior citizens. It's really older adult, and not even older, adults. So I'm looking at those who are 40 and greater. So it's not necessarily senior citizen. So erase that part. But here's some actually more than six, it's 8. Initially I had 6, but I decided to add 2 more just to give an understanding of some of the screening tools, some of the testing that should be done or you should be getting done on a frequent basis. So the first thing first is eye and hearing tests, okay? As we get older, our eyesight starts to decline, our vision starts to decline. And so having an eye exam is very important because it not only helps, especially when you start noticing some blurriness to your eyes and as a result of either glaucoma or cataracts, early detection of either or can prevent you from getting as in cataracts, maybe temporary blindness, or glaucoma can prevent you from getting permanent blindness from glaucoma. And glaucoma, I was actually going to want to do a live on glaucoma because January is Glaucoma Awareness Month. But on top of that, glaucoma is one of those silent diseases that you don't realize you have it until it's too late, until it starts to have an effect on you. And for all intents and purposes, what is glaucoma? Glaucoma is when you have high blood pressure in the eye. So sometimes when you have high intense pressure in the eye, you can feel it. You can have eye pain and redness and maybe some tearing. But sometimes it's very silent and you have the high blood pressure in your eyes, but you don't realize it until it's too late, like I said. And it tends to, glaucoma is very prominent with Blacks, essentially. And if you have a family history of someone who has glaucoma, there's a high chance that you may have glaucoma. So it's very important early detection by getting your eye exam. They can do a pin test where they check the pressures in your eyes to ensure that your pressures in both eyes are within normal limits. So that's one. An eye exam for those who are above 40 to 54, you may want to get it every 2 to 4 years. But as we get past 55 and above, you may want to do it 1 to 3 years. Again, you want to do an eye exam and then have them make sure that they test your eye pressure just to rule out any glaucoma. And if you're diabetic, they likely need to look in the back of your eyes to see the vessels in the back of your eyes and make sure that those vessels are intact, because the blood sugar what happens in diabetes is essentially you have high sugars in your blood, and that sugar can go into the blood vessels of the eye and cause a lot of damage. So if you are diabetic, you really want to get your eye checked every year just to make sure you're not having any problems at the back of your eye, because that can also lead to blindness in diabetics. When it comes to hearing tests, older people, you want to get your hearing test really if you start exhibiting symptoms. So what are some of the symptoms? If you start noticing loss of balance, if you start noticing ringing of the ears, and definitely if you start noticing reduced hearing or some sort of abnormal hearing, you want to get your ears checked at that particular time. So then we move on to diabetes. Diabetes, very, 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 very important to get it checked. And usually you want to typically do that maybe, and I probably should do it this way because this is cutting it off. Okay. Usually you want to do that maybe every 3 years, but you likely have to do that more frequently if you have a family history of that, if you're obese, if you have high blood pressure, heart disease, or high cholesterol. You would likely need to do it like annually. And actually, to be honest with you, I think it's okay to have it annually tested. Again, the sooner you know about your blood sugar levels, the better it is for you. Because having high blood sugar is not a good thing when it's not detected, because it can affect your kidneys, your liver, your heart, just about any organ in your body. So the sooner you get it nipped in the butt, the better. Someone says, yes, I have glaucoma and regular testing is key, just as Dr. Mercy said. Yes, thank you. And your family members should also get testing as well. Early detection is key because I too have a family history of glaucoma in my family, and I make sure to get that checked, especially every single time I change my glasses because of that history. Because unlike myself, some of my relatives do live in Africa, and with lack of access to healthcare, their glaucoma has gotten to the point where they're literally blinded in one eye, despite now recognizing that they have glaucoma and taking medication for it. What people don't understand is the glaucoma medication can help prevent damage. It can help prevent damage, but once the damage is done, it's irreversible. So like I said, the sooner you get it detected, the better it is for you. Okay, has it too, so that's why I know. Okay, see, and so because your mother had it, that's why you went ahead and got checked. Great, that's awesome. So going back to the diabetes, okay, so we talked about diabetes. So yes, get tested. So now we talk about blood pressure check, cholesterol screening, and bone density scan. We can go through each one of them. Blood pressure check, really, everyone should have it once a year. It's very simple to do. You don't really necessarily have to have it in your doctor's office. You don't have to wait until you see your doctor for your a wellness visit. You can do it. They have blood pressure machines in stores, both a blood pressure stand in stores, as well as you can buy a blood pressure machine in stores. It's just something to check. This is another aspect that, another condition that causes havoc to the body. That's why they call it the silent killer. Again, in my medical mission trips that I've had done in the past, I have come across with people who have had blood pressure levels as high as in the 200s, and they're walking around like like nothing is affecting them. When you ask them, hey, do you have headaches? They're like, oh yeah, once in a while I get headaches, once in a while, not knowing that they're a ticking time bomb ready to explode in the form of either a stroke or a heart attack. So it's really imperative not only to get your blood pressure checked, but if you do have blood pressure medications, take them. This is another thing I've noticed. I work in the hospital. People, I guess once they feel like they're good, they stop taking their medications. No, especially when it comes to blood pressure medications, it's key to keep the pressure in your body low, within normal limits, because if not, it affects the heart, it affects the brain, it affects the kidneys, liver, pretty much any organ that it can affect, it affects. So if you are on blood pressure medications, also, not only do you consistently take your medications, but also once in a while check your blood pressure to ensure that it's still within normal limits. Some people come in with high blood pressure readings because they don't really check on a consistent basis, while some people come in with low blood pressure readings because, you know what, the medication has now become too strong for them, and they're having these headaches and they want to pass out. They can't find a reason why, and they really didn't bother to check at home. So if you are on blood pressure medications, just, once in a while, just check to ensure that your blood pressure is still okay. And then the next thing, cholesterol screening. So those who are age 45 with no known history, especially with women, of heart disease, it's okay to get it checked about every 5 years. But those who have known history, they probably should get it checked a lot more sooner, like annually. Again, why? Because cholesterol, just like diabetes, wreaks havoc to the blood. So you can have, just like, and I always like to tell people this analogy, and I don't know if people understand it. Your blood cells are almost like a donut, okay? They kind of look like they're donut shaped, okay? As they're going in the vessel, okay, they're surrounded by fluid. And depending on, your condition, if you have too much sugar in your blood, the fluid, it's almost like you glazing the blood cell. And that glazed blood cell is not able to do its function. And that glaze of a blood cell starts to throw sugars in different places that it's not supposed to go. Same thing with cholesterol. If you have too much cholesterol in the blood, it will affect the blood cells. So it's important. Not only does it affect the blood cells, but it clogs the pipes of your heart. And clogging the pipes of your heart leads to a heart attack. So if you can get your cholesterol levels checked, and if you are on cholesterol medication, and if it is high, be placed on cholesterol medication. And if you are on cholesterol medications, get it checked annually. That would be great. The last screen on this slide is the bone density scan. So as we get older, our bones are not as robust and tend to be brittle, depending on how well we consume vitamin D and calcium and some other minerals like phosphorus. So these brittle bones can break. And that's why you see, as we get older, older citizens, just by falling, they end up breaking their hip. So to prevent hip fractures from occurring, it's really important, starting at 65, to get a bone scan. And what it is an image that is done to look at your bones to see how strong they are, to see how much calcium or vitamin D it has, how strong it is. Is it brittle or is it strong? And depending on that, if you are really low, it's a term called osteoporosis. And if you have osteoporosis, we have to give you some medications to get your bones more stronger. So that's really important. Again, bone scan to help see how brittle your bones are, and that ultimately helps you with not getting any further fractures. So we move on to vaccinations. This is back in the day, this used to be a topic that just everybody talked about and moved on with their day, but it seems like now it's something that has been a controversial topic, but notwithstanding, we still have to talk about it. So vaccinations, it is a good idea to stay up to date with your vaccinations. Just to give you just a general overview, here are some of the vaccinations that we do as physicians or as medical providers look for our patients to have. We can always recommend. At the end of the day, it's up to you if you want to take it or if you don't want to take it. So tetanus shot, and tetanus shot, we typically, if you've been up to date as a child, teenager, and maybe early adult, we typically say that in order for you to continue to be up to date in your tetanus shot, that you should get it a booster every 10 years. Again, to prevent any illness from that. COVID-19 vaccination, again, y'all are aware of the different boosters that are available. It'd be something that your doctor will talk to you about, especially if you have risk factors like your immune system is compromised. And so if you did get COVID-19, you would be one of those who have a high risk of not making it. they may want you to, consider having the vaccination. Shingles. So shingles is a condition that is essentially chicken pox after childhood, really chicken pox. So what happens with shingles is that it's a virus. It's the same virus that causes the chicken pox. And if you had chicken pox when you were younger, sometimes that virus, although the chicken pox resolved, sometimes that virus stays dormant in your system, meaning it stays underneath the system. It's not really active until later in life it peers its ugly head into this skin condition called shingles, which is very painful and it's just a little bit of uh, looks like little small boils, and it's itchy to touch. And so to prevent that from happening, a lot of times after the age of 50, we recommend having the shingles vaccination. Pneumonia, very common. Again, as we get older, our immune system starts to not be as active as we once were. So usually they recommend having the pneumonia vaccination at age 65 so you can prevent yourself from getting pneumonia, because you can get pneumonia in your 20s and you're pretty much, for the most part, if you have a really good immune system, you're pretty much fine. But once you get 65, 70, 80, yeah, it starts to affect you if you get pneumonia. Meningitis, same thing. If you have it in your 20s, you can likely survive it. But if you start getting it as an older person, it's a little bit harder to survive. So it's not like you can't, but you do have an increased risk of the severe form of meningitis. So it's a good idea to get the vaccination. Flu, we typically have that once a year. Again, it's something to consider, especially if you're immunocompromised. That's something to consider. Hepatitis B, typically you get that when you are, teenager or child. But if you haven't, it's good to get it. It is definitely acquired through either through sexual contact or through blood contact. And then varicella vaccination. This is for those who have not had chickenpox before. And if instead of getting the chickenpox would rather get the vaccination, that is also something to consider. So now I'm going to go on with the cancer screenings. So this is also really, really important. Out of everything, when it comes to cancer screenings, if I was just to sum up a lot of it, is get to know your family history when it comes to any cancer diagnosis. If your aunt, if your uncle, if your mom, if your dad, if your siblings had any form of cancer, that's something that you should be screening for as soon as possible. So let's say your aunt had breast cancer in her 20s. In your 20s, if not earlier, you should definitely already start having your mammograms and screenings for that. Because a lot of these cancers, they do occur as a genetic thing, but it can just occur because of environmental risk factors, air quality, exposure to certain environments, like if you're next to like a radioactive plant, you're definitely going to affect you, or drinking very chemically high chemicals in your water, or even some of the foods that we eat can increase your risk or can activate a cancer gene that would have probably been dormant had you not been exposed to an environmental exposure. So definitely really understand your family history, because that is also key as to what type of screening you should have. So for males, prostate cancer, typically at the age of 55 or older, you want to start talking to your doctor about what options you should do in terms of screening for prostate. They're going to ask for your prostate cancer family history, and then from there decide if it's a blood test, if they should do imaging, what sort of thing they should do, even examination, what sort of thing they should do for that. When it comes to breast cancer, at age 40, you should have it every 1 to 2 years. And then after 50, also continue to have it 1 to 2 years, and continue depending on your risk factors. Like I said earlier, if you have a family history of breast cancer, you really should start earlier than 40, depending on the age of when that family member was first diagnosed. And you can always rely on your primary care doctor to help you navigate that. If you have any questions on when you should start screening of any sort of thing. So colon cancer usually starts, typically we used to say at age 50, but I guess some cancer associations have now brought it down to 45. And definitely, just like with breast cancer, if you have a family history of colon cancer even earlier than 45, you really need to get started checking for colon cancer earlier. And there's many different ways to get screened. You can get the colonoscopy, which is essentially a camera that goes through your anal area and goes into your colon, or they can test blood in your stools. You know, there's just a number of things that they can use, and your doctor can help you navigate that as well. Going along with cancer screening, lung cancer is something primarily for those who smoke. So if you have a smoking history I believe it is, if you're first of all age 50 and above, you have a 20-year smoking history, 20-pack-year smoking history, and you're currently smoking or had been smoking within the last 15 years, you definitely should get checked and screened. And how they screen you is they do this scan of your chest to look for any spots in your lungs. And if there is a spot in your lung, they may either want to go and get a sample of it, or depending on how small it is, they'll monitor that. So if you have a long-term smoking history, it's good to get screening for lung cancer as soon as you can. Cervical cancer is something for women starting at age 30. You should be having pap smears every 3 years, or even before 30. Actually, having pap smears every 3 years, or HPV tests every 5 years. And those who have risk factors or have family history of it should definitely get it early. All of these screening, again, talk to your doctor when it comes to that, because depending on your individual history, they may have you do it earlier or later, depending on the tests that they do use or your risk factors. So, all right. And I think I am done when it comes to screening and the various tests that should be done when you get or see a doctor on a consistent basis. Again, knowledge is power. And so my goal is for you to have an idea of what we're checking when we do those annual physical exams or the annual visits. Having your basic general labs is key, because at that point, when we're checking them, we're checking for any signs of anemia, which is low blood count, any signs of kidney issues. Again, like I said, any signs of high or low glucose issues, and even how your thyroid is doing. And of course, we talked about your cholesterol. So I would make it a habit in the beginning of the year, new year, new you, to get checked. And the sooner you know, the better it is for you. So with that, you guys, I think I am done. Thank you guys for tuning in. Again, we have this every Friday, so I hope to see you on another live. Until then, have a wonderful day and have a wonderful week. See you later. Bye.